Today, CBC News Network is taking a closer look at the global response to the Ebola outbreak in West Africa. Countries and even wealthy individuals have promised funding and logistical support to fight the disease. Here's a look at some of what's been offered by the numbers. Cases of Ebola are doubling roughly every 25 days. The death toll stands at 4,546 out of 9,191 confirmed, probable, and suspected cases in Guinea, Sierra Leone, and Liberia. Ottawa has so far pledged $65.4 million to the fight. And yesterday, the Ontario government said it would donate $3 million to aid agencies working in West Africa. Also yesterday, Canada shipped the first batch of 800 vials of an experimental Ebola vaccine to the World Health Organization. The Canadian Red Cross claims that the pace of the outbreak is outstripping its ability to respond, and it is urging Ottawa to send medical personnel to West Africa. The donation from Ontario will be divided with $2 million to the Red Cross and $1 million to Médecins Sans Frontières. Eric Hoskins is the Ontario Minister of Health and Long-Term Care. Great to have you with us.
Hi, Amanda.
Eric, I want to start with overall how you think Canada measures up in terms of how we've responded. And I guess we could put that in the context of how the world responded, and we would agree it was fairly slow. How do we measure?
Well, I think when you look at the support provided by the federal government and then the announcement, as you mentioned, by Ontario of $3 million to Doctors Without Borders and to the Red Cross, that Canada is stepping up when it comes to the crisis in West Africa. And the way that we look at it here in Ontario is that we need to be vigilant, and we need to be prepared here in Ontario and in Canada. At the same time, we need to be part of the solution in West Africa to eradicate this virus.
I mean, I agree that we're obviously doing something. $3 million in the context of a government that will run a $12 billion deficit is a small number. Can you give me some context around what it'll mean to those aid agencies?
Well, what it's going to do for both the Red Cross and for Doctors Without Borders, Médecins Sans Frontières, is that there are a number of healthcare workers from Ontario, in fact, aid workers, that some of them have already gone to West Africa, others are being deployed there, so it will support them in terms of their costs associated with them, lending their expertise and their logistical and medical support to those in Liberia and Sierra Leone and Guinea. As well, it's going to help with both on a number of measures on the prevention side, on contact tracing, and on that all-important treatment of those who are positive for Ebola.
So let's talk. You've spent time there. You know what the situation on the ground is like. It does seem that it's a lot safer to contract Ebola in a Dallas hospital and be treated there than it is on the ground in Africa, and we can imagine the many reasons for that. But how much more could we be doing to make the healthcare system there better able to respond to the needs of those people in Africa on the ground who are dying every day?
Well, that's you pointed out the fundamental problem. So to give you one measure of the difference, here in Canada we have one physician for about every 400 citizens. In Liberia, for example, they have one physician for every 74,000 physicians. So the entire healthcare infrastructure, even before this crisis, was devastated by civil unrest and the wars in both Sierra Leone and in Liberia. So really, you can't even compare, unfortunately, the healthcare system that they're faced with in that region, in that part of Africa. So as a result of that, they're unable to, they don't have the equipment, the personal protective equipment that's required to protect the healthcare workers effectively, and then they simply don't have the numbers of well-trained healthcare workers. That's why it's so important that the rest of the world, that we infuse cash to support the containment and eradication of the virus. But at the same time, we need to infuse those countries with dedicated and experienced healthcare personnel.
So we have seen, obviously, with the example of Nigeria, that it is possible to contain and then eradicate. In your view, how big a task are we talking about if we had the personnel and the resources to turn our attention to Africa to actually stamp it out?
Well, this is going to be extremely challenging, and we've seen the aid workers as well as government officials and others, the UN, that have spoken to the challenges before us, that there's still, as you mentioned, almost 10, I think they're above 10,000 cases now, roughly half of those individuals that have died as a result of contracting Ebola. But this epidemic will be stopped. As difficult as the challenge before us is, the question is simply a matter of when and how and what resources the international community can put to bear to be able to help those impoverished and challenged West African countries eliminate the virus and stop the spread. And as you mentioned, in Nigeria, they've been successful, as well as in Senegal. So there is no doubt in my mind that it will be contained and stopped, but it's important that we continue to ramp up our efforts which quite frankly have been delayed.
Minister, where would you put on the list of priorities actually getting a working vaccine at whatever cost that takes in order to actually kill this forever?
Well, I think fundamentally that is the solution that we need to look towards in the long term. I think in the short and medium term, however, it's unlikely we're going to have access to a vaccine that can then vaccinate and protect the population. What we need to do, and it's logistics more than anything else, so it's the identification of the cases and the suspect cases, it's the contact tracing of those that might have come into contact with them, and it's making sure that we are providing healthcare workers who have the talent and expertise and the protective equipment that they can deal with those cases and provide them with the supportive care that they need. So it's a big challenge, and quite frankly, that is how we're going to solve this. So the vaccine, as important as that is, I think that the vaccine is something which is going to be most effective in the medium and long term and perhaps into the future.
All right, we've only got a minute here, but obviously you're also concerned about how Ontario responds and what our preparedness is. What would be your message to people who are feeling nervous and in some cases possibly unduly so?
Well, I think it's it's a frightening disease, and we see that in West Africa, and so, or even in Dallas in the United States. So I think it's right for people to be anxious and to be, in some cases, to be nervous about it. But I want to reassure Ontarians and all Canadians that we're prepared. We've been preparing for the last number of months. In fact, Ontario just issued a new directive last Friday, which talks to training as well as the sort of equipment that needs to be prepared or provided to healthcare workers on the front line. In fact, what the nurses across this country, as well as the federal health minister, said is Ontario really has set the bar for the rest of the country in terms of the level of protection, the equipment they're providing, the training that's necessary to make sure we're protecting our frontline healthcare workers, and by doing that, we're protecting the public.
All right, Minister, we appreciate your time today.
You're welcome. Thank you.
Eric Hoskins is Minister of Health for Ontario.